January 20th, Maddie received her second dose of the Pfizer COVID vaccine as a participant in the clinical trial for 12 to 15-year-olds. All three of our kids volunteered and were excited to participate in the trial as a way to help us all return to normal life. My husband works in the medical field, and I have a degree in electrical engineering. We are pro-vaccine and pro-science, which is why we agreed to let Maddie and her two older brothers volunteer for the trial. Before Maddie got her final dose of the vaccine, she was a healthy 12-year-old who got straight A's and had lots of friends. She had a life. She was energetic. She was not like this. Although she does still have lots of friends. Upon receiving the second shot, Maddie immediately felt pain at the injection site. Over the next 2.5 months, her abdominal, muscle, and nerve pain became unbearable. She had developed additional symptoms that included gastroparesis, nausea and vomiting, erratic blood pressure and heart rate, memory loss. She mixes up words, brain fog, headaches, dizziness, fainting. She fell and hit her head, and then seizures. She developed verbal and motor tics. She had loss of feeling from the waist down and muscle weakness. Drastic changes in her vision, urinary retention and loss of bladder control, severely irregular and heavy menstrual cycles, and eventually she had to have an NG tube put in to get nutrition. All of these symptoms are still here today. Some days are worse than others. Our greatest challenge came when her doctors began to consider an alternative diagnosis. Well, she really didn't have one before. So, because they couldn't figure it out, one physician labeled her as having functional neurologic disorder.